Tout le monde est bienvenu à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole lors de la séance d'information de cet après-midi. La Dr. Jennifer Russell, médecin hygiéniste en chef, l'Honorable Blaine Higgs, Premier ministre du Nouveau-Brunswick. Good afternoon, everybody, and welcome to today's update on COVID-19 in New Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thank you, Bruce. Good afternoon, everyone. Bonjour, bon après-midi. Before I start, I just wanted to mention that today is Doctor's Day, so happy Doctor's Day to our fellow physicians out there. COVID-19 affects everybody in different ways, but particularly in some provinces, the challenges are quite significant for physicians and even physicians here in this province in terms of what they have to face. So I would just want to take the time to acknowledge their hard efforts and that they, again, have many challenges ahead of them, as do we all. And so making sure that you check in regularly with one another. We can all use some support during these challenging times, so check in with each other. And if you see a physician out there, if you think about it, thank them. Bonjour tout le monde. Aujourd'hui, c'est le journée nationale pour les médecins. Alors, je voulais remercier tous les médecins, tous mes collègues qui travaillent très, très fort durant cette période de pandémie et ils ont des défis uniques des fois qu'il faut gérer et aussi en temps de pandémie, le stress puis la santé mentale, c'est important aussi pour les médecins. Alors, je voulais encourager de remercier vos collègues, les médecins que vous connaissez aussi et si vous avez accès de support de santé mentale, c'est important aussi qu'on vérifie avec nous, entre nous, dans ce temps. So once again, I am pleased to report that we have no new confirmed cases of COVID-19 in New Brunswick. And of the 118 cases confirmed to date, 116 have recovered from their illness. And we have no patients requiring any level of hospital care at this time. So that is very, very good news. But we are still actively searching for cases of COVID-19 in New Brunswick, and that's why we expanded our testing criteria earlier in the week. So we would really encourage you to watch for symptoms of the illness for yourselves and your family and get tested, please. Encore une fois, aujourd'hui, je suis heureuse d'annoncer qu'il n'y a aucun nouveau cas confirmé de COVID-19 au Nouveau-Brunswick. Des 118 cas confirmés jusqu'à présent, 116 sont rétablis de la maladie. Personne n'a présentement besoin de soins hospitaliers quelconques dans la province pour une infection à la COVID-19. Alors ça, c'est des bonnes nouvelles. Cependant, nous poursuivons nos recherches pour dépister des cas de COVID-19 au Nouveau-Brunswick. Vous devez aussi continuer à vous surveiller et à surveiller les membres de votre famille pour l'apparition de symptômes de la maladie. Parce qu'on sait qu'en hors de nos frontières, les cas de COVID existent encore et vont continuer à exister. Alors, c'est pour ça qu'il faut vraiment être vigilante encore. Earlier this week, we broadened the list of the symptoms that would trigger a COVID-19 test, and since then, we have seen an increase in the number of calls to 811 and in the number of tests administered. I believe we're over 500 since yesterday. In terms of tests that were completed. So I urge anyone who is experiencing any 2 or more of the symptoms to call 811 immediately and follow the directions given. So the symptoms of COVID-19 would include fever above 38 degrees Celsius, a new cough or worsening cough, sore throat, runny nose, headache, new onset of fatigue, new onset of muscle pain, diarrhea, loss of sense of taste, loss of sense of smell, and in children, purple markings on the fingers or toes. Voici les symptômes de la COVID-19. Fièvre au-dessus de 38 degrés Celsius, nouvelle toux ou toux chronique qui s'aggrave, mal de gorge, écoulement nasal, mal de tête, fatigue nouvelle apparue, nouvelle douleur musculaire, diarrhée, perte de goût ou de l'odorat. Et chez les enfants, ça peut arriver qu'ils peuvent présenter avec des taches mauves sur les doigts ou les orteils. The combination of any of these may seem insignificant, particularly as we come into the end of the season for colds and the start of allergy season. A runny nose and a sore throat may seem routine for many of you at this time of year, but it is very important that if you are experiencing any two of these symptoms that you should report it. In particular, I ask parents to regularly check their fingers and toes for purple markings. This symptom has been recently reported as an indication of COVID-19 in children. An appearance of these purple markings will trigger a recommendation for testing, even if no other symptoms are present. It is crucial that everyone be watchful for symptoms at this time because we are becoming more mobile as we move down the road to recovery. L'apparition de taches mauves entraînerait une recommandation de subir un test de dépistage, même si aucun autre symptôme n'est présent. Il est essentiel que chacun soit à l'aguet de symptômes à l'heure actuelle, puisque nos déplacements augmenteront au fur et à mesure que progressons dans le processus de rétablissement. And when we move, the virus can also move. A week ago, the government announced the first lifting of restrictions under the provincial state of emergency. And one of these measures is the opportunity to have greater contact with others by extending your bubble to include another household. There is a risk in extending contact between people during a pandemic. And obviously, the safest place is to be at home in your own home, minimizing your contact with others. But that can't be sustained indefinitely. So as a first step, the risk can be controlled if contact is limited to one other household. And it's very important to stay in your bubble, because one household unit joined to another household unit and avoid the temptation to go beyond it. Again, this is to prevent further transmission of the disease if we do see more cases. So when we see more cases. If you have matched up with a family, friend, or relation, neither group can form a bubble with anyone else. And this sets up a potential for a chain of contagion where infection could be passed between groups. And again, that's what we're trying to minimize, especially with people who are at higher risk. So anybody of any age who has a chronic medical condition, people who are over the age of 60. So we really want to protect all these groups of people. Il est très important de demeurer dans sa bulle, soit un ménage qui se regroupe avec un autre et de résister à la tentation s'élargir sa bulle. Si vous vous êtes jumelé à un ami de la famille ou à un parent, aucun membre de votre bulle de deux ménages ne peut se regrouper avec un autre ménage. Une telle situation pourrait causer une transmission en chaîne permettant à l'infection de se propager entre les groupes. So a grandparent cannot form bubbles with families from each of their children and grandchildren. And it's not something that we would encourage in terms of separate meetings on alternating weekends either. So because there are potential consequences and they can be quite unfortunate and serious, as we know. So the bubble has to be exclusive between two household groups. So the temptation to stretch the rules is real. And if you go looking for a loophole, then chances are you will find one. So, but if that happens, then again, you're putting yourselves and others at risk, and in terms of COVID-19 and the virus would be following along with you. I understand that this requires hard choices, particularly for grandparents who want to be with their grandchildren, but I'm asking you for your continued patience and adherence to public health advice. We are being cautious and we're moving slowly towards recovery, but we are moving. And I want everyone to stay healthy and be safe as we move towards recovery. So more than ever, this requires your cooperation and vigilance. And again, I would like to thank everybody thus far who has been doing their part in helping us achieve the success that we have so far, but we do have more work to do. Je vous demande de continuer à faire preuve de patience et à respecter les consignes de santé publique. Les réunions de famille sont attendues seront encore plus réjouissantes le jour où il sera possible pour tous de se rassembler en se sentant davantage en sécurité. Nous faisons preuve de prudence et progressons lentement vers le rétablissement, mais au moins nous allons vers l'avant. Je veux que tout le monde demeure en santé et sécurité. Et on va aller doucement et lentement. Et plus que jamais, nous avons besoin de votre collaboration et de votre vigilance. We have come a long way, but we still have a long way to go. Let's support each other and maintain the success we have built together. Thank you very much. Merci.
Good afternoon. Bonjour. Today marks 13 consecutive days without a new case of COVID-19 in New Brunswick. This is indeed good news. Tous les gens de Nouveau-Brunswick devraient être fiers de cette réalisation. Vous avez travaillé fort pour arriver à ce résultat. But as we head into the weekend and spend time with those in our two-household bubble, we must remain vigilant. This is a time for us to be cautiously optimistic, with the emphasis on caution. Going almost 2 weeks without a new case of COVID-19, some may think we no longer have to worry about the virus. This is simply not true. We are still vulnerable. We are surrounded by COVID-19, and though we are doing our best to keep New Brunswickers safe, we are still very much at risk. À mesure qu'un plus grand nombre de personnes retournent au travail, et à mesure qu'un plus grand nombre de personnes profitent du beau temps à l'extérieur, notre risque de contracter ces virus augmente. Some risk is unavoidable, but you can minimize your chances of exposure by obeying the emergency order and following the directives of public health. We are gradually reopening our province. Nous avons travaillé tellement fort pour en arriver là. Ce n'est pas le moment de prendre des risques inutiles. Prendre de tels risques pourra ramener tout le monde en arrière et mettre en danger la santé et la sécurité de tous les gens de Nouveau-Brunswick. Be proud of how well New Brunswick is doing. Be optimistic about what this means for the coming days, but remain cautious. Continue to wash your hands. Stay 2 meters or 6 feet apart from anyone outside your bubble. If physical distancing is hard to maintain, consider wearing a mask to protect yourself and others. Don't let your guard down now. Nous remercions les gens de Nouveau-Brunswick pour tout leur effort afin de contenir la propagation de ce virus. Nous avons assoupli certaines restrictions, mais plusieurs restrictions sont encore en place. At this time, it is still important that our border restrictions remain in place. We need people outside the province to understand that New Brunswick is closed to non-essential travel. Travelers who are trying to enter New Brunswick for non-essential reasons are being turned away. This is true for those arriving at our borders by vehicle as well as those arriving by other means. People arriving at airports are also being turned around and directed to return home at their own costs. These steps are necessary to keep New Brunswickers safe. As important as it is to remember that we are still vulnerable to COVID-19, we must also remember that this is flood season in our province. People living along rivers and waterways should remain vigilant as rain and warmer weather is in the forecast. Flood levels will be reached this weekend in the Gagetown area. Les équipes de l'Organisation de mesures de région de Nouveau-Brunswick et du ministère de l'Environnement et des gouvernements locaux, ainsi que leurs partenaires de partout dans la province, surveillent la situation de cours l'eau chaque printemps. Et c'est la même chose cette année. 5-day forecasts of anticipated water levels in the lower and upper St. John River Valley are available on the Riverwatch website. Residents should be on alert for rapid increases in water levels. Follow authoritative sources like the New Brunswick Emergency Measures Organization or the Government of New Brunswick on social media for the latest information. Stay safe this weekend and in the days ahead. C'est une période difficile, mais il est important de prendre un moment pour regarder tout le chemin que nous avons parcouru jusqu'à maintenant. We have reached this point by working very hard together. We will continue to do so, not only because we are stronger together, but because this is how we do things in New Brunswick. Thank you. Merci.
Merci, Monsieur le Premier Ministre. Dr. Russell, thank you, Premier. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We'll now proceed with questions from the media. You do have the right to pose your question in the language of your choice. Steve Llewellyn, Daily Gleaner.
Good afternoon, Premier. Can you hear me?
Can.
Yes.
Premier, I'm doing a story on when farmers markets might reopen. Can you comment on that issue, and can you talk at all about timing, please?
Farmers maybe open on the market?
Yes, farmers markets, when they might reopen, like grocery stores.
Yes, just a second. Dr. Russell, would you like to comment on that?
Hi there. So from a public health perspective, we have discussed markets at an earlier stage in some of the discussions about what to reopen and when. We're not quite fully prepared to move down that path right now, but certainly exploring it for the future in terms of what types of things and what types of measures would have to be accommodated, et cetera, to make it safe to operate a market. We will be having some further discussions, but it's not, it wouldn't be upcoming in the next round of phased openings.
Do you have a follow-up today, Steve?
No, that's good. Thank you very much.
Thank you. Elizabeth Fraser, CBC.
Hi there, my question is for Dr. Russell. Because of all the protective measures we've taken this winter, has your department noticed or been made aware of a drop in flu cases or seasonal bugs in the past couple of months? Shouldn't physical distancing and hand washing also have stopped the flu?
I think I peeked at those numbers earlier on when this was happening, and I feel like the numbers that I saw were definitely a decrease in hospitalizations and bad outcomes from influenza. I just don't have the numbers off the top of my head, but I can get those for you. But I feel like early on when we did see those social distance or physical distancing measures in place, I believe we did see a drop. But again, I can confirm that with our data because we do produce a weekly report, which I believe is available online.
Thank you, Doctor. Do you have a follow-up today, Ms. Fraser?
Yes, I have another question for the Premier. Are people allowed to be voting now, and what restrictions are in place for people who might cross provincial borders by boat? CBC has heard about voters sailing up to Canada from the U.S.
So I guess, and certainly people have a opportunity, they have a right to go out in their boat, again, assuming they're family members and they're within their bubble. But we have had this discussion with public safety, and we're recognizing that as boating season is coming upon us, that there will be a need to look at other possible entries, a point of entries into our province. So that activity is not going unnoticed, and it will be monitored, and we will be ensuring that boat traffic is not ferrying people from other provinces or, let's say, from other jurisdictions into New Brunswick undetected. We will be watching for that.
Thank you, Premier. Thank you, Ms. Fraser. Vicki Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, given that many New Brunswickers are unemployed and that the real estate market is in limbo, property values may be negatively impacted by COVID-19. Is there any thought being given to canceling this year's increase in assessed property values or even rolling it back?
I think that what we would expect is that residents certainly would appeal their property values if they feel that they've been negatively affected, which I can understand that there'd be reason to feel that way. We've also extended the appeal process deadline to allow for that. So we will look to each, each individual or family or situation to appeal their tax form as they feel appropriate to do so.
Thank you, Premier. Do you have a follow-up today, Ms. Hogarth?
I do. Thanks, Bruce. It's for Dr. Russell. Dr. Russell, last Friday you mentioned that we now have sufficient personal protective equipment. Can you elaborate on what that means?
I didn't hear your question. Can you repeat it, please?
Can you please repeat it, Vicki?
Last week you mentioned that we have sufficient PPE. Can you elaborate on what you mean by sufficient?
Sufficient. Well, we have enough for right now. In terms of stockpiles, that is something that we actually have just recently finalized all of the numbers on how much we have, how much we're using. We actually have a modeling exercise that was done to be able to keep track of that. So it is something that will be under constant discussion and review for the entire pandemic. We do know that at the global level that procurement will constantly be an issue. So it's something that we constantly have to review and revise in terms of our approach. We definitely want to make sure that we're not using more than we absolutely need to, but we also want to make sure that staff feel protected and have the necessary equipment. And so again, we have actually a dedicated working group just on PPE that meets very regularly. The task force, the pandemic task force, meets on this topic regularly. So we have set guidelines around it, and again, we will continue to monitor that. The most recent discussion has really been around, well, if your numbers are so low, does that impact the usage? And so again, these conversations will be ongoing as the situation evolves. Because again, we know we have a good stockpile right now. We definitely want to make sure that we're using it appropriately. And again, as the situation changes in terms of the number of cases that we're seeing and what the risks are to the population and to healthcare workers, we definitely want to manage that. And again, we will be continuing to have those discussions.
Thank you, Doctor. Thank you, Ms. Hogarth. Laura Brown, CTV.
Hi there. We got a notice from the city of St. John that they're installing physical barriers at skateboard parks and dog parks. They're also putting rocks in the parks to stop people from going there and using them. They say that people are not adhering to the state of emergency mandatory orders. But I'm wondering, at this point, have you heard of people still not adhering to those orders? How many tickets have been given out to date? And for a skateboard park and a dog park, could those be considered places where people could start to use because they're outdoors, like we're seeing people being able to go golfing?
I think that and Dr. Russell may want to certainly add to my comment here, but I think that in relation to facilities like this, a concern was anywhere where people would gather. And you'd get, a kind of a mass of people showing up. And I think a dog park would be such a location. A skateboard park would be such a location. A playground would be such a location. So when we talk about being in parks, it was about being in open spaces where people could, walk as their family type, or certainly respect social distancing. And that is the concern. So in the St. John example that you've used, I would suggest that they are experiencing maybe the situations that aren't respecting the public health rules, and therefore they're putting the appropriate measures in place to limit that activity, in which they should do.
Thank you, Premier. Ms. Brown, do you have a follow-up today?
Yeah, just a quick one. A good one, I guess. At this point, early on in April, you had said the projections were 15 deaths at this point in New Brunswick, and that would be the best case scenario. Can you comment on where we're at now, and if those projections have been updated, and do you have new ones for the end of May?
I don't. I would have to check with my epidemiology team about new projections. Again, the latest projections that I was aware of were around our PPE supply and the usage rates of that. But certainly, right now, our main focus is to continue to test at a high enough level that we can be confident in our results. So I had met last night with the medical officers of health and the public health team at the Office of the Chief Medical Officer of Health, and we are looking at moving forward what other kinds of things we want to implement in our testing strategy. So we'll probably be having some more conversations on the weekend with the task force, and then probably coming out with some new directions next week.
Thank you, Doctor. Thank you, Ms. Brown. Silas Brown, Global TV.
Hi, this one's for the Premier. We've heard recently the idea of creating a bubble zone between Prince Edward Island and New Brunswick raised. I'm wondering what your feelings on potentially looking at opening up travel even within the Maritimes, or potentially just with Prince Edward Island, or any of those sorts of things. What are your feelings on potentially seeing some regional travel happening, maybe at some point throughout the summer?
Well, I think that the, and Dr. Russell may want to certainly add to my comment here, but I think that in relation to facilities like this, a concern was anywhere where people would gather. And you'd get, a I think that certainly there'll be many discussions held with the particular public health authorities in both provinces to discuss that possibility. I know that Premier King and I have discussed it in terms of our current situation in relation to our provinces and COVID, and what the possibility. I know they're starting to open up, I think, in a similar categories that we are. You know, is there a possibility coming down the road in the summer in July, August timeframe? I guess we'd always like to think there's a possibility, but we are very cautious about our borders, and we will remain so. And I guess if we saw at this stage any relaxation in that regard, it would likely be in the PEI's direction. But it'll be very well understood, and public health on both sides will play the key role here.
Thank you, Premier. Thank you, Mr. Brown. Mr. Brown, do you have a follow-up today?
Yeah, I guess you mentioned that if we do see anything, it's likely towards PEI. Would the situation in Nova Scotia have to, I guess, markedly improve in order to consider bringing them into a tri-provincial bubble, if you were?
So all the provinces and jurisdictions around us, including PEI, Nova Scotia, Quebec, and Maine, all have different situations with respect to the number of cases, the types of transmission they're seeing. And so any decisions we would make about our borders would be based on that information, and it would also be based on our own information. So currently we have great data right now on the traffic that's coming across our borders, and we're planning to analyze that a bit more closely in the coming week, and also using our epidemiological data so that as we move forward, eventually we would be able to really fine-tune that data and understand how it can inform decisions and next steps in when and how to change whatever border measures are in place right now. But as of right now, we are not planning to change any of those border measures, but definitely as things evolve, that could change.
Thank you, Doctor. Thank you, Mr. Brown. Mathieu Bois-Comeau, l'Acadie Nouvelle.
Bonjour, ma question est pour Monsieur le Premier ministre Higgs. Monsieur Higgs, on a appris aujourd'hui que l'Assemblée législative était convoquée pour le 26 mai. Qu'est-ce que vous pouvez nous dire là-dessus?
Well, you likely learned it about the same time I did, as a discussion that we asked LAC to give us we gave them information, or they gave us some suggestions, and we asked them to give us recommendations on how we might open. So they chose the date, working with the House leaders of all parties, of May 26th. So I haven't looked at what the requirements will be in terms of how we open, whether I assume that certainly the social distancing practices will be first and foremost. Can we open in a safe manner? Is it going to be more of an electronic process like we see federally? But yes, that date has been set, and so we'll be working towards that in some fashion for opening.
Merci, Monsieur le Premier ministre. Monsieur Bois-Comeau, as-tu un suivi cet après-midi?
Oui, merci Bruce. À nouveau pour Monsieur Higgs. Vous avez dit tout à l'heure, durant votre discours, vous avez parlé des gens qui arrivent au Nouveau-Brunswick sans raison, qui sont retournés chez eux, même ceux qui arrivent aux aéroports. Est-ce que c'est nouveau comme mesure de retourner les gens qui arrivent à l'aéroport à leur propre fait? Et est-ce qu'on a dû retourner beaucoup de gens à partir des aéroports depuis qu'on fait ça?
It's not a new policy, and I do know of a couple of cases where people will turn back that were just coming for visitation. Friends and for non-essential reasons. So, but it's not a new policy. We are watching our borders from all areas, and certainly as the previous question talking about access to our province via the water, we're assessing how best to monitor that as well.
Thank you, Premier. Merci, Monsieur Bois-Comeau. Shelley Steeves, Global.
Yes, my question is for Dr. Russell. We've spoken to some people here in New Brunswick with visual impairments who are really having a difficult time navigating through the community, in particular going shopping. You can imagine how difficult it would be right now to navigate through a grocery store with stickers in the lines if they're not unable to see them. But some of the people we've spoken to, as well as the CNIB, are a little apprehensive about what might happen
a person with a visual impairment were to go shopping with a sighted guide, for example, would they be exempt from the mandatory 2-meter physical distancing and not have to worry about being fined if they were to go out shopping together?
Correct. That would probably be most likely considered an essential service, obviously like a healthcare worker. So that person obviously couldn't do essential things without that person with them. So from that perspective, as long as if they can wear a community mask, that would be strongly recommended.
Thank you, Doctor. Do you have a follow-up today, Ms. Steves?
I'm just wondering if any information pertaining to that is going to be provided to maybe some of the grocery stores or some of the businesses, because we are hearing some reports of some people actually being turned away who've been with guides, and I'm wondering if there's any chance that you might be sending out additional information.
Yeah, we can follow up with that.
Thank you, Ms. Steves. Thank you, Doctor.
Thank you.
Adil Ibrahim, CBC.
Thank you. This question is for Premier Higgs. When we were in the red zone, it was not advisable that people would go to their cottages and camps, but what we'd like to know now, is it safe, and when will it be safe for New Brunswickers to open up their cottages and camps, and what are the restrictions right now?
When we moved into the first phase, it was to allow residents of the province to move around more freely all the while respecting the public health requirements. That includes people going to their camps or their cottages, and as we said, once again, opening up and enjoying our province and the many, I guess, beauties that it offers. So it is part of the Phase 1 program, recovery program.
Thank you, Premier. Do you have a follow-up today, Ms. Ibrahim?
Yeah, I just want to make sure that that means it is allowed for people to go to their cottages and camps?
Yes, it is. Yes, it is.
Okay, and the other question for Premier Higgs is, I'm wondering what message is the province sending to organized team sports? So is there a way to play baseball, soccer, or basketball safely right now? When will the decision be made?
Well, not right now, in my understanding. Certainly, I guess that Public Health and Department of Health will be looking at ways to analyze when teams may come forward with, in the future, not at this time, but in the future, with some recommendations of how they may practice some sports in a safe manner. I think what we're asking, of any activity is basically, you can propose to us what you think meets the current guidelines, because that will be first and foremost of what we're looking for, and that'll be assessed by Public Health, and they'll determine can we meet, is this a risk that we can accept at the current level of our COVID-19 pandemic, and we go from there. So if someone has some thoughts in that regard, I think the obvious issues that are concerned, when we see team sports, or we think about that. I mean, you think about a group on a basketball court, that's just not meeting the health guidelines.
Hang on.
Thank you so much.
Ms. Ibrahim, hold on.
Okay.
Dr. Russell's coming to the podium.
Yeah, I just wanted to add that as we move through the different phases, there will be a lot of general advice for organizations and businesses that they can work with to formulate how they would be able to operate safely. So that public health advice will be given in a broad general sense, so that kind of information can be quite beneficial to those organizations to start thinking about what it is that they need to do to be able to operate safely. And some will be able to succeed more easily than others, but certainly as this evolves, we're not rushing, we're taking our time to make sure that that information is communicated very clearly.
Thank you, Doctor. Thank you, Ms. Ibrahim.
Thank you.
Adam Harris, Telegraph Journal.
Thanks, Bruce. Question for the Premier. Prime Minister Justin Trudeau introduced a ban on military-style grade assault weapons in Canada today. Your government's opposed a ban on that to date. This ban today does ban the weapon that the Moncton shooter used in that rampage 6 years ago. I just want to know, have you had any change in heart on whether there's a need for a ban of military-grade assault weapons, and just your position on the issue?
I think that, certainly in light of your reference to Moncton event, that situation and that devastation in that case and loss of lives, And then certainly most recently in Nova Scotia, and that being a horrendous event and with 22 lives lost. It warrants a discussion on what type of rifles, or as we're referring to here as military assault rifles. I think that the question has always been, what type of guns are we talking about here? And that'll be the discussion I'm sure going forward is what would be acceptable to rural law-abiding citizens, and the fact that some of these rifles just you can't understand why people would want to own one. So I don't know the policy yet. I know it just was announced. I don't know the details, and we'll be talking. I do know that public safety is looking at it. Our Attorney General's office is looking at it. So they're working together, and we'll have formalized a position here coming forward. But I haven't read the release and what's being proposed at this point.
Thank you, Premier. Mr. Hears, do you have a follow-up today?
Thanks. Yes, please. Premier Higgs, just a follow-up to the question from Matthew. I had not heard either of turning people around at airports if they've landed from another province. I thought there was a 14-day isolation period in place for people entering through airports. Can you just clarify that policy, when it began, and how you're informing people who are getting on planes from elsewhere in the province or elsewhere in the country coming to New Brunswick?
Well, the policy hasn't changed. I mean, if you have a home here in New Brunswick and you're coming home, that's one situation which obviously we are accepting people to come back to their home in the province, and then they have to isolate for 14 days as we would have expected. But when you're coming and you land at the airport and you don't have a home to go to, you're visiting friends as a social exercise, that doesn't meet the requirements that have been in place from the beginning, essentially. So there's nothing new here. It's just a continued enforcement of our borders.
Thank you, Premier. Thank you, Mr. Harris. Michel Corriveau, Radio-Canada.
Merci, Bruce. J'ai une question pour le Premier ministre. À la reprise de l'Assemblée le 26 mai, est-ce qu'on s'attend à ce qu'il y ait une période de questions et est-ce que cela va durer plus qu'une journée?
So at this point, I do believe that what's being suggested by the opposition parties and Woodlack is that how would we put together a legislative process that would certainly be typical to what we've seen in the past, and that in that scenario it would include a question period and going through the normal routine proceedings. I think that we need to work out what those might look like and kind of where we are at that point in time, what routine business would be coming forward that would make it, a typical type of session. So it's early. It was just kind of given us the date was just kind of put forward, but we'll be working together with our colleagues to determine what the new normal looks like in the legislature, what is appropriate to be discussed and addressed at this point. So. To my colleague's point that we're keeping the public informed, there's debate that respects the democratic principles, and that we can continue to focus, as we have been, on the pandemic and the economic recovery of our province throughout our province.
Merci, Monsieur le Premier ministre. Monsieur Corriveau, as-tu un suivi cet après-midi?
Oui, j'aurais une question pour Dr. Russell. Alors, Dr. Russell, en Europe, on fait état à l'heure actuelle d'une maladie qui frappe les enfants qui auraient été en contact avec le coronavirus, une maladie qui frappe les enfants et les adolescents, qu'on appelle Kawasaki. Est-ce que ce syndrome de Kawasaki est présent au Canada et est-ce qu'il a été observé au Canada et au Nouveau-Brunswick?
Je n'ai pas entendu des nouvelles ou des recherches sur cela, mais je peux définitivement trouver des réponses pour demain. Oh, lundi.
Merci.
Merci.
Merci, Monsieur Corriveau. That concludes today's update. Thank you very much. C'est là que l'on conclut la séance d'aujourd'hui. Merci.